If you are looking for a new primary care doctor, good luck with that. Need to see a specialist? You might be waiting a year or longer.
The physician shortage in Hampton Roads is bad and getting worse. 10 on your side, Stephanie Hudson has been digging into what's behind the drop-off in doctors and what we need to do to fix it.
Tom and Lena, it's a problem across the country and it's growing. Tonight, we're looking into why in many cases when you need an appointment, the doctor won't see you now. When Jim Purical moved to Norfolk in 2023, he started shopping around for a doctor.
There were certain doctors that looked like they were available, but when I made the phone call, I was informed that they were not taking any new patients.
He expanded his parameters, first 25 miles, then 50 miles out.
And so now I'm starting to get concerned.
Purical's frustration is felt across Hampton Roads, where new patients are scheduling appointments 10 months to more than a year out.
Is the perfect storm here in Hampton Roads.
Armistead Williams, a retired doctor from Norfolk, is now working to save the profession and people he's taken care of for 45 years.
We realized there was a need and there was nobody else going to speak up and say, this is a problem, this is a hair on fire problem.
Williams, along with accountant and consultant Bruce Holbrook, have done a lot of research to diagnose the condition of local health care.
So right now we're in a huge crisis. I mean, we can't wait a year, we can't wait 2 years. We need to start recruiting doctors now.
At the root of the crisis is a short supply of doctors and increasing demand from patients.
And what does that mean for overall for the people living in our community?
It means we're not as healthy.
When ranked by county, Norfolk, Portsmouth, Suffolk, Newport News and Hampton all have worse than average health outcomes for Virginia, and all but Suffolk are faring worse than average for the nation.
We're a sick area, and we need more doctors.
But why now? Where did all the doctors go? Their research points to three main drivers of demand. Medicaid expansion in 2019 gave medical insurance to 50,000 people who didn't have it before. Military readiness. In 2017, the DoD shifted to wartime readiness. That reduced the number of medical staff at Portsmouth Naval Medical Center, sending military families into the community for care. And baby boomers. They're affecting supply and demand. That generation is getting older and sicker, while those in healthcare are getting out.
And I've consulted with some family practice groups around there, and you go out and talk to them and say what's happening. And 4 to 5 of them were going to retire in the next 2 or 3 years, and they can't replace them.
Williams says for every doctor who retires, it takes 1.5 new doctors to replace them.
Quality of life. They don't want to work like I did when I came to town. And it's true, you ought to be able to go home and have supper with your children.
The cost of medical school is also dissuading some from pursuing a career in medicine at all.
Everybody else wants these doctors too. And if we're going to be competitive, we have to have the work-life balance and the compensation.
Pay-to-stay scholarships could help. Just last week, EVMS announced 2 $20 million endowments from local philanthropists to establish scholarships for Virginia students who plan to practice in Hampton Roads. Centera also committed to providing $350 million in dedicated funding over the next decade. Holbrook says it's a start.
That's good, but they could commit to even more than that. Centera has the money to fund it, and the cities and the state has to realize it has to be done.
It took Purical 10 months to see a healthcare provider, over which time he developed a shoulder injury that now prevents him from lifting and playing with his daughter the way he used to.
Had I had maybe some sort of a diagnosis at that time, then it wouldn't have gotten to the level where it's at right now, where it's kind of constant pain.
Well, the Defense Department is now working to bring military families back into the military health system. Also, Centera's Director of Communications said Centera is committed to expanding its physician training, adding new fellowship programs, and expanding existing residency programs, both of which will help, but it will take years to play out. So what can you do now? Dr. Williams says, appreciate the doctor you have and keep yourself as healthy as possible. Stephanie Hudson, 10 on your side.